Dr. Michael Weiner. Dr. Weiner is a pediatric oncologist, philanthropist, and author. He served as the head of pediatric oncology and vice chair of the Department of Pediatrics at Columbia. He has made major significant contributions in the diagnosis and treatment of children and adolescents with leukemia and lymphoma, and is nationally recognized as a leader in the management of Hodgkin's disease. He has mentored a generation of pediatric oncologists, and through his more than 45-year career has cared for thousands of patients. He is the founder of Hope and Heroes Children's Cancer Fund, a 501c3 charitable organization he began 25 years ago to support patients, families, special programs, and research at Columbia. Other charitable endeavors include board memberships on the Children's Board here at Columbia, Ronald McDonald Charities of New York, Medical Advisory Committee of Hyundai Hope on Wheels, and as a consultant to the Valerie Fund Charity of New Jersey. Dr. Weiner has a deep knowledge of all aspects of philanthropy and charitable giving. Dr. Weiner is also an author. His recent book, Living Cancer, Stories of an Oncologist, Father, and Survivor, is an Amazon bestseller. He has edited several medical textbooks and is the co-author of Images of the Baby's Hospital, a chronicle of the fourth oldest children's hospital in the United States, which we're going to hear more about today. Good morning, Dr. Weiner, and thank you so much for joining us.
Just having a difficulty going back to the first slide, just a moment. Well, I think I'm going to start from here. May I do that? Can everyone hear me?
Absolutely, it looks great.
Okay. All right, so the first thing that I'd like to share with everyone is a disclaimer that the history of the Babies Hospital is long and rich. The hospital, its faculty and staff helped shape the growth of pediatrics as a specialty in the United States. And the photos in this book represent that history, but they're not inclusive. And the photos presented in this talk this morning might demonstrate my own personal bias and the many years that I spent at the Babies Hospital. And I hope that I'm not going to offend anyone if I have not included them in the presentation. So please accept my apologies now for that misstep, if you will. So the history of Columbia University College of Physicians and Surgeons dates back to 1767 with Dr. Samuel Bard. During the when he became the first physician at Columbia University College of Physicians and Surgeons. And we can now fast forward to the Civil War and the post-Civil War. And I just wanted to give you a picture of what New York City was like during that era. There was corruption from Tammany Hall. There was immigration through Ellis Island. And there was rampant infectious diseases. And there were perhaps 4 or 5 women who came together, but led by Sarah McNutt and her sister Julia McNutt, who incorporated the Babies Hospital in 1887. And this was the first hospital exclusively for children less than 2 years of age in New York City. There's debate about whether or not the Babies Hospital is the 3rd oldest or the 4th oldest. Certainly, Children's Hospital of Philadelphia and Boston Children's were 1 and 2, and whether or not we were next or Cincinnati Children's is debatable. But we are certainly within one of the oldest children's hospitals in the United States. The first hospital was a 4-story brownstone, and I'll show you a picture of that in a moment. That was on the corner of Lexington Avenue and 45th Street. But that first building and the Babies Hospital ran into some financial difficulty. There was a legal case brought by some of the neighbors who didn't like the idea of sick children being in their Upper East Side neighborhood. And Sarah McNutt resigned her position after but 2 years and was succeeded by Emmett Holt, who I will tell you about in a moment. Dr. Holt is responsible for a new building on between 657 and 659 Lexington Avenue. It opened in 1891, and the baby's hospital then moved again in 1901 to a new modern 7-story facility. This is a photograph of Sarah McNutt. She was a pioneering woman physician. She was born in upstate New York. She received her medical degree from the Medical College of the New York Infirmary. And she, with Abraham Jacoby, who I didn't realize at the time, relates his early history to Columbia and the baby's hospital. They founded the New York Postgraduate Medical School. And McNutt was a neurologist, and she was the first woman to be elected to the American Neurological Association. And this is the building, the first permanent home of the baby's hospital, which was on Lexington Avenue. It remained the home of the hospital until 1902, when Emmett Holt and refurbished a second building. Now, Dr. Holt was perhaps one of the most famous pediatricians in the history of our specialty. He received his medical degree from Columbia College of Physicians and Surgeons and became the director of the baby's hospital in 1888 and served in that position for 34 years until 1922. He published Holt's Care and Feeding of Children, but in 1896, he was the editor of the Diseases of Infancy and Childhood, which through 1996 has gone through more than 20 editions and still exists today. This is the baby's hospital that I'm so sorry. Holt was a favored lecturer and teacher at the College of Physicians and Surgeons. He became a professor of pediatrics at the medical school in 1901, and he established the foundation of an academic department. He was dedicated to combating infectious diseases, reducing infant mortality, promoting new specialties, including surgery, and Baby's Hospital became one of the most celebrated pediatric institutions, and Holt, one of the foremost pediatricians in the country. In 1916, there was the first major polio epidemic, and in New York City, there were close to 9,000 cases and almost 2,500 deaths in the city alone. But there also was what was called the Spanish flu, or the Black Plague of 1918, and there were 130 cases of children with influenza treated at the Baby's Hospital. And interestingly, there was not a single death during the Black Plague of 1918, secondary to the extraordinary care that infants received at our institution. This is the picture of the new Baby's Hospital that was started in 1901 and completed in December of 1902. It had 5 spacious wards, 55 beds, quarters for nurses and students, a laboratory, chapel, and solarium. It cost $48,000. And as you can see, many of the wealthy families of New York during New York's golden age were contributors to this construction of the building. This is an interesting phenomenon, which I learned doing our research for this project, that from 1888 through 1931, there was a Baby's Hospital summer hospital. So the institution in New York closed its doors during July and August. And at the summer hospital, which was located in Rumson, New Jersey, infants were ferried to the institution 3 times a week, and they spent their convalescence, or if they were ill, they were treated at the summer hospital. And there were 3 buildings erected in 1895, and it included 3 wards, and it was closed in 1931. And it's very reminiscent, I think, of the Children's Hospital of Philadelphia has a facility which I believe is still open on the Jersey Shore, which they use as a convalescent hospital. So I wanted to introduce you to some of the people that were part of Dr. Holt's early department. And the first is Dorothy Reed, who is a person whose name that I know well, because in 1901, she discovered the Reed-Sternberg cell, which is identified as a diagnostic marker for Hodgkin's disease. But Dr. Reed did not have an easy career. She was a graduate of Johns Hopkins, and the famed chair of medicine at Hopkins, Dr. William Osler, told her that medicine is not a place for a woman, and a medical education is wasted on women. Nevertheless, Dr. Reed had an extraordinary career. The next person of note is Martha Wallstein, who was the first resident in training at the Babies Hospital, and she became the first pediatric pathologist in the United States, spent her entire 45-year career at the Babies Hospital. She was the first perinatal pathologist in North America and had expertise as well in pediatric infectious diseases. And she determined the etiology of mumps as being caused by a virus. And in 1930, Dr. Wallstein was the first woman elected as a member of the American Pediatric Society. Next is Dr. Robert Abbe. And Dr. Abbe was a surgeon, and he's credited with performing the first nephrectomy in a child when he removed a 2-pound tumor from an 8-month-old female, which was probably at the time of a Wilms tumor. But Dr. Abbe was also interesting in that he befriended Marie Curie, and together they discovered radium, and he was a pioneering radiologist at Babies Hospital, explored the use of radiation and X-rays, and in 1904 introduced the use of radiation to treat cancer, and is credited as the founder of radiation oncology in the United States. But he continued to be a surgeon at the Babies Hospital, treating children who needed his services. The next person that I wanted to introduce you to is Bernard Sachs. And Bernard Sachs was one of the founding members of child neurology in the United States. And he founded the Division of Child Neurology at Columbia's Neurological Institute. And child neurology under Dr. Sachs was the first service in the nation focused solely on the distinct neurological needs of children and their developing nervous system. He was a prolific author. He wrote The Nervous Diseases of Children. He wrote a book on the normal child. He classified cerebral palsy, but his name continues in perpetuity because he is with a British ophthalmologist named Warren Tay. They described Tay-Sachs disease And they noted that it had a high prevalence in Ashkenazi Jews from Eastern Europe. It is also an interesting phenomenon that Dr. Sachs' brother is the financier who was one of the founding members of the firm Goldman Sachs. So this clearly, the Sachs family had some extraordinary talent and brain power. This is a gentleman called Herbert Wilcox. And Herbert Wilcox was a graduate of the College of Physicians and Surgeons. He trained as an internist, but not uncommon in this era. He spent his entire career as a practicing pediatrician, and he succeeded Dr. Holt in 1925 as the physician-in-chief and was the first Carpentier Professor of Pediatrics at Columbia's College of Physicians and Surgeons. And it was under Dr. Wilcox's leadership that the construction of the baby's hospital in Washington Heights took place. And he was also responsible for affiliating the baby's hospital with Columbia University College of Physicians and Surgeons. So Dr. Wilcox, although did not have the fame and reputation of someone like Emmett Holt, clearly had a major impact on our specialty and was responsible for much of the future, setting the course of the future in the 20th century. He was also the director of the New York Academy of Medicine and served as president of the American Pediatric Society. And this is the Columbia University College of Physicians and Surgeons. And this was a groundbreaking for the construction of Columbia Presbyterian Medical Center. And as I mentioned, the move up to the campus in Washington Heights occurred under Dr. Wilcox's tenure as chairman. And this is the baby's hospital that Dr. Wilcox led the construction, moving it to the campus. And you can see the Presbyterian Hospital in the background. This was a massive fundraising effort, a highly successful campaign, raised $1.75 million. And the construction began in 1928 and was completed in 1929. And this was a just an incredible situation. Following Dr. Wilcox's chair of pediatrics is another giant in the field, and that is Rustin McIntosh. Dr. McIntosh was a Midwesterner. He was educated both as an undergraduate and graduate at Harvard, and he served in France during the First World War, and after the war returned to Babies Hospital to complete a residency and was the director of the outpatient clinic, and was appointed the chair of pediatrics in 1931 and was the Rubenesque Carpentier chair. And he remained chair until 1960, so his almost 30 years as chairman of the department. And he brought the hospital to international renown and established pioneering services in a number of child subspecialties, including psychiatry, surgery, radiology, and others. And he was responsible for the recruitment and mentoring of a number of extraordinary physicians, some of whom I'm going to introduce you to. And the first is Hattie Alexander, who received her medical degree at Hopkins and became an instructor and researcher in 1932 at the Babies Hospital. She served as the president of the American Pediatric Society, and she was the first woman to occupy this position. And her renown is secondary to the development for treatment for Haemophilus influenza, where she found that streptomycin was a highly effective medication against this previously fatal illness. Joining Dr. Alexander in this era was Dr. Dorothy Anderson, who was actually a pathologist, but in 1938 described cystic fibrosis of the pancreas. And in 1942, she and a colleague, Paul de Saint-Agnès, developed the sweat test, which is the first efficient and accurate test for this disease. And this is a Dr. Saint-Agnès, who was Dr. Anderson's colleague. There was a heat wave in 1949, and they observed that infants who suffered from cystic fibrosis were at special risk of dehydration, and they had abnormalities in the salt content of their sweat. And this led to the discovery of the sweat test, which remains still one of the primary diagnostic tools for cystic fibrosis, even today. William Silverman was a neonatologist, and he was a graduate of University of California, Los Angeles, and received his medical degree in San Francisco. But postgraduate training was at the Babies Hospital. And in 1946, he was appointed the first director of the neonatal intensive care unit. And he is considered to be one of the early innovators of evidence-based medicine, and where scientific evidence guides clinical decision-making. He also described retinopathy of prematurity, or retrolental fibroplasia, which he noted was related to elevated oxygen concentrations that infants received. And here he is at the bedside, at a bassinet, instructing 2 residents in the care of a newborn. Virginia Apgar, also a member of Dr. Holt's department, graduated from the College of Physicians and Surgeons and completed residency at our institution. Dr. Apgar was actually an anesthesiologist and was the first woman named to be chief of this subspecialty. In 1949, she became the first woman in our history to be a full tenured professor. She studied infant mortality, as everyone knows, and especially within the first 24 hours of life, and developed the Apgar score, which is the standard scoring system still used today to assess newborn health. Dr. Apgar never married, but she enjoyed a rich life of not only in medicine, but enjoyed fishing, golf, and stamp collecting, and was actually an excellent violinist. And she is known for making her own instruments. And Virginia Apgar is perhaps one of our most famous people affiliated with our institution. The next slide is one of a New York City premature infant transplant program. And as you can see, this premature nursery, which had been founded at the Babies Hospital in 1949, and we started accepting infants from all over the city. And as you can see, the carrier for this infant, there is an oxygen source attached, but the device is not much different than a carrier for a pet. And this is one of the first infant transport services that existed in the United States. And it was established to bring sick newborns to the nursery at the Babies Hospital. The Next person that I would like to introduce you to is Dr. Algernon Rees. And Dr. Rees was a graduate of Harvard, and he joined the Columbia Presbyterian Eye Institute in 1928 and was the founder of ophthalmic oncology. And Dr. Rees is known for creating the classification and staging system of a tumor of the eye called retinoblastoma. And the classification is called the Rees-Ellsworth classification, and it is still used today. And at the time, there were three institutes of renown to treat children with retinoblastoma or with oncologic problems. One was at the Babies Hospital with Dr. Rees. One was Will's Eye in Philadelphia. And there was also a center in at Johns Hopkins. But certainly Dr. Rees was really shaped the field of ophthalmologic oncology. And he trained a generation of ophthalmologists who still today practice and are very well known in this field. Our next person to introduce you to is Dr. Richard Day, who described a complex disease called the Riley-Day syndrome. And this was most commonly found in children of Jewish Ashkenazi descent. It's caused by a defect in a gene that is inherited from both parents. And symptoms of the disease include seizures, vomiting, labile blood pressure, inability to produce tears, and it usually led to early death. And this was due to this illness. The Riley-Day syndrome is attributed to Dr. Day. Next is someone that I knew, actually. This is Dr. Sidney Carter. And Dr. Carter was a world-renowned pediatric neurologist, and he trained with Houston Merritt, who was originally at Harvard and then came to Columbia to be the chief of adult neurology, or of the Neurological Institute. And he's quoted as saying, Dr. Merritt is quoted as saying to Dr. Carter, "I want you to head pediatric neurology." And when Carter protested that he did not know much about pediatrics, Dr. Merritt, always pithy and laconic, replied in one word to Dr. Carter. He said, "Learn." So Dr. Carter was the chief of child neurology at Columbia from 1951 through 1978. And he is recognized as one of the founding members of the subspecialty of child neurology, and really established this specialty as one of the leading programs in the country. And it's still today, child neurology is considered to be one of the foremost programs in the United States. He received, under his leadership, they received the first NIH pediatric neurology training grant. He was instrumental in the decision to create the American Board of Psychiatry and Neurology and to grant a certificate in pediatric neurology. And as I mentioned, he is credited with making Columbia the center of child neurology in the United States. He was a soft-spoken, gentle physician with incredible knowledge, and it was really an honor to know Dr. Carter and sit through some of his lectures, which I still recall even today. This is a photograph of a child a little girl who is beginning the process of having her hearing tested. And there was a clinic called the Lester and Hofheimer Speech and Hearing Clinic. And this photograph was taken in 1955. And you can see the device is quite similar to a stethoscope. And the technician is whispering words into this device, and the child is raising her hand to recognize if she is able to hear. This training was required and needed for this child to go on into nursery school. I thought this was just a terrific early photograph, and we all know how far this testing has come today. In our next photograph, which was taken approximately in 1945, it shows the Columbia Presbyterian Medical Center campus, and the baby's hospital is at right center, and we're facing Broadway and overlooking the hospital gardens. Now, following Dr. Mcintosh as chair of pediatrics is Dr. Ed Kernan. And Dr. Kernan received his undergraduate degree at Yale, a medical degree from Harvard, trained at Boston Children's. He also was a specialist in pediatric infectious disease and was instrumental in his work on mononucleosis, dengue fever. He served as chair of pediatrics at University of North Carolina and was appointed Carpentier chair in 1960 and oversaw the construction of the Babies Hospital South, which you can see in this photograph. Today, we refer to Babies Hospital South as the central building. And just of note, it was when completed, it was a 12-story building, but at inception, funding was short, and they only completed 4 stories, including 2 basement levels and 2 above ground. Work resumed in 1968, and the building was finally completed in 1970. This gentleman is Dr. James Wolfe, who was one of the first pediatric hematologists, oncologists in the United States. And Dr. Wolfe was at Boston Children's Hospital training with Sidney trained with Sidney Farber. And he participated in one of the most important discoveries in pediatric medicine of the 20th century, and that is the discovery that aminopterin, when given to children with leukemia, could put them into complete remission. This was published in 1948 in the New England Journal, and Dr. Wolfe came to Columbia at the Babies Hospital in 1949 and was appointed the first full-time director of the Division of Pediatric Hematology Oncology. He was one of the founding members of the Children's Leukemia Group B and a very distinguished alumnus. And it was Dr. Wolfe who was my boss when I first came to Columbia in the mid-1970s. I worked in Dr. Wolfe's division. The next slide is Dr. Mom, who was a pediatric cardiac surgeon and of quite renown. The field of cardiac surgery really began at Johns Hopkins with cardiologist Helen Taussig and surgeon Alfred Blaylock. But Dr. Mom was one of the early initiators of enablers of open heart surgery in children, and served as the first director of pediatric thoracic surgery. I'm going to move a little more quickly. This is Dr. Stanley James, who was a collaborator of Virginia Apgar in establishing the scientific basis for the APGAR score. Dr. James was a director of perinatal medicine for 20 years at the Babies Hospital from 1972 to 1992. He received numerous awards for his work in neonatology as a mentor and as a scientist. Tom Santulli was the first pediatric surgeon to be appointed director of pediatric surgery. He had a more than 40-year career at Columbia. He worked with doctors Winters and Hurd to advance the field of fluid and parenteral replacement therapy, and is considered to be the father of pediatric surgery, one of the fathers of pediatric surgery. We have the Santulli Lecture Series and the Santulli Library named in his honor. Bob Mellons, who many of you know, was a native New Yorker. He joined the faculty in 1997, was the first director of pediatric pulmonary medicine, had a long distinguished career of more than 40 years as director of pediatric pulmonology. He received numerous awards for his work in asthma and pathophysiology of pulmonary disease, and in particular asthma. And Dr. Mellons recently passed away, and we all remember, those who knew him remember him fondly. Prior to the PACS system, we had two extraordinary pediatric radiologists. The first is David Baker and his colleague Walter Burden. And doctors Baker and Burden followed Dr. John Caffey, who was the first director of pediatric radiology, and Dr. Baker assumed that position in 1949. Together, Dr. Baker and Burden edited the textbook, Caffey's textbook of pediatric radiology. They were two extraordinary people, extraordinary radiologists, and it was always great fun to walk into the reading room and see hundreds and hundreds of films on the light boxes as they sorted through some of the early CAT scans. Our next picture, really, I wanted to show you was Sylvia Griffiths. And Sylvia Griffiths joined the faculty in 1955, and with Sidney Blumenthal founded the Division of Pediatric Cardiology. Dr. Griffiths is still alive, and this photograph was taken at Sylvia Griffiths Day, and you can see some of our more recent colleagues in pediatric cardiology, Julie Vincent, who was the director of cardiology, Leo Liberman, and Teresa Lee, also in the photograph with Dr. Griffiths. John Schillinger was a phenomenal pediatric surgeon. He completed his training at Columbia. His father was a surgeon at Columbia before him. He also treated children in China, trained Chinese surgeons, treated Chinese children. He had expertise in neonatal surgery and reflux. He won numerous awards, and Dr. Schillinger is retired, lives in Maine, and enjoys fly fishing, and still occasionally returns to our institution. Jerry Jacobs was a teacher and mentor, joined the faculty in 1960, and became the first director of pediatric rheumatology. Dr. Jacobs has trained generations of pediatric rheumatologists, and was the author of Pediatric Rheumatology for the Practitioner. This photograph is of Richard Berman, In the center, Dr. Berman was the chair of pediatrics from 1971 to 1976. He left to go to Case Western Reserve and then on to Stanford, where he was instrumental in starting the Lucille Packard Children's Hospital and Foundation. Following Dr. Berman was our own Dr. Katz. Dr. Katz was born during the Second World War in Poland, emigrated to the United States, was an expert in tropical medicine and received his degree from downstate. In 1970, he was appointed professor of public health, and in 1972 was appointed Carpentier Chair, a position he served until 1992. He then left and had a second career, a distinguished career as Vice President for Research at the March of Dimes. He was a consultant to the World Health Organization and a lifetime member of the American Society for the Advancement of Science. Dr. Bill Speck also had spent much time at Columbia. Dr. Speck is a pediatrician. He served as chair of pediatrics at Case Western Reserve. Then in 1992, Dr. Speck came to Columbia Presbyterian and was appointed the chief executive officer. And it was during Dr. Speck's tenure as director of our hospital that the merger with Weill Cornell took place. In 1997, Dr. Speck was appointed president of the New York Presbyterian Hospital, and today serves as a professor and emeritus professor of pediatrics. The next photograph is of Dr. Eric Rose, not a pediatrician, but many of you know Dr. Rose had all of his training at Columbia, became the youngest chief of cardiothoracic surgery and the youngest chair of surgery. He was an associate dean, and he led the surgical team that performed one of the earliest and most successful heart transplants in children. And this date is still remembered as one of the seminal events in the history of our institution. This is Dr. Darrell DeVito, who succeeded Sidney Carter as director of child neurology and continued the excellence of cardiology, of neurology, excuse me. He was a founding member of the Colleen Giblin Research Laboratories. His expertise was in neuromuscular disease, and he still is active today and continues to run his research laboratory. Those of you who knew Dr. Altman, I'm sure, remember him fondly. He was appointed director pediatric surgery in 1980. He was a pioneer in hepatobiliary surgery. He is credited with the staging system for spina bifida and meningomyelocele. Dr. Altman took a second position, leaving pediatric surgery, was succeeded by Charlie Stoller, and Dr. Altman became an executive vice president at the Morgan Stanley Children's Hospital, and he was a consummate surgeon, educator, and a very dear friend. I'm sure many of you know Dr. Ann Gershon, who trained at Cornell, trained at Baby's Hospital in infectious disease, and is credited with her work in the varicella vaccine, focusing on children with leukemia and the immunocompromised. And Dr. Gershon still remains at our institution and continues her research even today. Dr. John Driscoll succeeded Dr. Katz as chair of pediatrics, and I'm sure many of you know and remember Dr. Driscoll. Dr. Driscoll was quite an athlete at Hamilton College, captained both the lacrosse and basketball teams, president of his class in 1948. He served in the Navy, joined the faculty of Columbia in 1971, and remained his entire career, and was the Carpentier Chair until 1997. Was appointed chair in 1997, and Dr. Driscoll was the chair of pediatrics when I became the chief of the Division of Pediatric Oncology, and he was a great friend and created new divisions in emergency medicine, critical care, and genetics. Dr. Poland, still very active today, a neonatologist today, is the William T. Speck Professor, still remains active in our department as an executive vice chair. He was recognized as Physician of the Year both at Columbia and the Morgan Stanley Children's Hospital, the editor of numerous textbooks, and received the National Neonatal Education Award from the American Academy of Pediatrics in 2006, and really is responsible for shaping the department, a division of neonatology as we know it today. This is the Morgan Stanley Children's Hospital, built on a plot of land on the corner of 165th and Broadway. It's our home today, 265,000 square feet. It was opened in 2003 and bears the name of the partnership of the financial services firm of Morgan Stanley. I'm going to skip these next few slides. There were many important visitors that came to our institution. Madeleine Albright, United States Ambassador to the United Nations and the first female Secretary of State, is pictured in 1993 visiting the institution. And with Dr. Driscoll and others is Dr. Alan Hyman, who was really one of the first pediatric anesthesiologists at our institution, and also chief of staff of the of Columbia Presbyterian Medical Center, and also father of Josh Hyman. And Alan Hyman is well and enjoying retirement in the Berkshires in the state of Massachusetts. Now, I wanted to show you this slide, and it's a picture of Cynthia Sparrow with Peggy Quinn, who is the one of the nursing leaders at our institution, and Max Gomez. And Cynthia Sparrow was really an incredible leader. She had a long history of excellence and leadership in pediatrics. She was executive director at Schneider Children's. She met Dr. Speck in Cleveland. And when he became the CEO of the institution, he appointed Cynthia as executive director of the Morgan Stanley Children's Hospital. And Cynthia really set the tone for the new institution and was an incredible leader, and really, I think, was very impactful in creating the institution that we know today. Just some more details about our present institution. It opened in 2003, has 269 beds, 100 medical surgical beds, 41 intensive care units, has the pediatric cardiac intensive care unit and 50 neonatal intensive care units. And the next slide celebrates the tenure of Dr. Driscoll, and pictured with Dr. Driscoll is Dr. Lee Goldman, who is the former dean and executive vice president and the chair of pediatrics at the time, Dr. Lawrence Stanberry. The photograph was commissioned by the Machalot family and painted by Christopher French. And I'm not sure where that photo, where that painting is today, but it used to be in the executive suite on the first floor of Babies Hospital Central. And the next slide just is one of, there were many important people from sports and who visited the hospital. This shows Alonzo Mourning, who was at the time a basketball player on the New Jersey Nets, but others were Willie Mays, Derek Jeter, Governor Carey, Michael Bloomberg. We had a lot of important visitors to our institution. I chose this next slide to introduce you to several important people. The first is Charlie Schlein, who was the director of critical care and is now the chairman of pediatric at Cones Children's Hospital and Northwell Health. And in the center is Stephen Miller, who was the director of the emergency room and an Arnold Gold fellow, and posthumously was awarded the American Academy of Pediatrics Education Award. And also pictured is Meredith Sonnet, who succeeded Dr. Miller as the chair of pediatrics. Now, this next slide is one that I am really personally, and those who knew him, remember Dr. Gold with great fondness. He's pictured here with a number of students. Dr. Gold was a renowned pediatric neurologist, larger than life, a master diagnostician, compassionate role model. And Dr. Gold and his wife, Sandra, founded the Arnold P Gold Foundation, which was created to sustain human connection in medicine. And the Gold Foundation is responsible for the white coat ceremony and the Gold Humanism Award. He was an incredible physician, an incredible philanthropist, and a role model for so many. Next is Welton Gersony, who succeeded Sylvia Griffiths as director of pediatric cardiology. He was appointed in 1968 as the Alexander Natus professor. He had expertise in the natural history of congenital heart disease and received numerous awards. Quickly, this is Hal Dick, who was the chair of orthopedics, and Dr. Dick was trained both as a hand surgeon and as an orthopedic oncologist, and was one of the early enablers in the development of prosthetic devices. And he's pictured here with a young patient who had osteosarcoma. And I'm sure we all know Dr. Lawrence Stanbury, who is a renowned virologist, came from Cincinnati Children's and then was director of the Vaccine Center at Texas, University of Texas Medical Branch at Galveston, was the chair of pediatrics from 2008 to 2018, and today is the associate dean for international programs and a very prolific author. This is a photograph of Dr. And Mrs. Roy Bagelos. Dr. Bagelos was a graduate of University of Pennsylvania, got his medical degree from Columbia, became the chief executive officer of Merck, numerous scientific awards, and a extraordinary philanthropist. And we have at Columbia the Roy and Diane Bagelos Education Center and building, and the Columbia University College of Physicians and Surgeons bears their name. They also gave a recent gift to Barnard College to create the STEM Education Center. Diane Bagelos was a graduate of Barnard. The Baby's Heart Fund is an organization that raises money for pediatric cardiology. Pictured here are Emil Basha, Chief of Cardiothoracic Surgery, Julie Vincent and Kim Targoff. This is the photograph of some of the leadership of the Hope and Heroes Children's Cancer Fund. This is a photograph of Karen and Kevin Kennedy with Dr. Stanbury. Dr. Kennedy was initially a nurse, subsequently went to medical school, graduated from Columbia, was a resident at Babies Hospital, and was the founder of the first, founder and president of the Children's Board at Columbia. And the Kennedys supported the Kennedy Family Endowed Chair to honor Wendy Chung. And this is our last slide, brings us up to today with Dr. Orange and his wife, Katie. Dr. Orange is a renowned scientist, a tremendous leader, and a great friend, and present chair of pediatrics, appointed in 2018. So I want to thank you for allowing me to share the history of our institution. I hope you get a chance to purchase the book and keep it in your library as a memento of a fantastic institution with a fabulous history. Thanks very much.
Dr. Weiner, thank you so much for walking us through some of the most incredible history. It's truly inspirational to see where we started and where we're going. So thank you. We really appreciate it. We know we're a little past 9, and so I won't ask any questions, but I will tell you that there are just so many words of gratitude and thanks in the chat. So thank you. Thank you for sharing this. And of course, the book is now available. Please feel free to reach out to us, to Dr. Weiner, to Dr. Orange, of course, if you would like to purchase a copy. So thank you. Have a wonderful day, everyone.